So I'm starting recording now. So I've got a couple of letters here. We'll start with Ray's letter at first. So let me just get this on and I'll turn on the screen share. And okay, let me get this done. Turn on the screen share. It depends what time I have available. Right, screen share, which one's this, Mrs. Potter? Okay, doke, right, so let's get ready for this. Can you see this letter? Can you see the screen now? Yeah? Can you see the screen? Somebody let me know if you can see this. Yeah, can you see it? Yeah? Right then, let's get on. So, right, now I don't have the case notes for this particular writing task, but I have seen it before, and I'll check the grammar and spelling, etc., and I'll tell you what I think about it. Okay, now Mrs. Potter, I think this is the one who, this is the retired lady. What's this? You don't have voice. Well, you have to check your settings. If you go to the bottom of the screen, you'll see a microphone icon, and you might have to go into the menu and choose your microphone. I think everybody else, you can hear me? Yes? Everybody else can hear me? Yeah. Ali says yeah. So it must be you haven't chosen the right speaker. That's probably what it is. Ali can hear me, so let me just close this window so you can hear me a little better. Okay. So I've got a couple of letters. I'll go to Telegram in a minute once I've finished, and maybe somebody else has posted a couple of other letters. Okay, so I'm going to save the changes here. I'm writing to Mrs. Potter, whose features are consistent with worsening arthritis, requiring a consultation for possible knee joint replacement. Okay, that's pretty good. That's all that you need for your introductory sentence, right? Keep it short, simple. Tell the reader what you want them to do. Okay, that's good. Initially, Mrs. Potter presented to my clinic with increasing pain in the left knee while walking over the previous 12 months. It is worth mentioning. No, okay, worth mentioning. You could have put that here, but I would be tempted not to mix in information within a paragraph. Okay, so you could put a social medical history, a paragraph. I would have, for this particular letter, I would have put the social medical history paragraph as paragraph 2. Where you mentioned she has had osteoarthritis since 2008 and the other things. True, yeah? So, because, you know, again, it's not good to mix information within a paragraph. So it should be about one thing and one thing only. So here, it should just be about what happened on that particular visit. So the patient comes, what they say, what you find, what you did. That has a logic, you know? The patient comes, they said this, I found this, the action I took was, etc. So try not to mix information in a paragraph. It confuses the reader. So this part here, okay, I would be tempted to leave that or put it, you know, paragraph 2. Okay. The pain was not alleviated by regular dose. Now it's regular dose. Well, dose is singular, so it's either a regular dose or regular doses, okay, of the painkiller and occurred. So the pain was not alleviated and it occurred even at rest following a long time walking. Why is this of note? Now, these expressions, it's worth mentioning of note. You don't actually need them. You can just say and instead of why exactly should we note this? unless it's really indicative of something. Okay, of note, now joint swelling or red snore, recent trauma were indicated. Now, that's good use of neither nor. Excellent use of linguistic features there. Neither nor. So that would get you some good points with the examiner. Upon examinations, what? Was she examined more than once? Upon examination, her left knee had reduced range of motion to pain tenderness on pressure as a result of blood tests were requested. The option was commenced. Okay. Now, you can use this passive, you can use it, but, you know, if you're the one doing the examination and prescribing, then we know who's performed the action, so there's no real need for passive. Simply say, I requested, I commenced, I prescribed, I diagnosed, etc. Okay? So, today I'll review the investigations. Well, they weren't investigations, we would call them tests. Investigating. I think tests is better. On review of the tests, investigating is what a detective does. He conducts investigations, you know. On review of a test, Mr. Both after the X-ray demonstrated severe away, and loss of joint space was normal. Then down is worsened away. Regarding, so you probably say my preliminary it's just like, therefore my preliminary diagnosis of worsened away, now advised on. You advised her to take. You can say advised on. We don't usually use on as a preposition with advised, but you know, it's understandable, so it's not detracting from the clarity of the message. Advisors and augmenting the analgesic dosage along with a surgeon. Now, surgeon. Now, we would usually make it an adjective form and say surgical referral, not surgeon. Surgical referral, because you are referring to a surgeon, but here you would probably make surgeon surgical as an adjective. I would appreciate it. Consult with her. Well, you wouldn't consult with her really, because she's not an expert. You might advise her, you might direct her, but you wouldn't really consult with you know, her. She would consult with you for surgical measurement you deem appropriate. Feel free to contact me. Okay, so that's pretty good. That's not bad at all. Not bad at all, Ray. I think that's pretty sweet. All I would say, really, is this sentence here, you could move it. Because, again, you don't want to be mixing things within a paragraph. Okay, that's all I would say. So, that's pretty good. Let me turn off the share. Where are we? Where's my controls? Mixing. Here we go. Stop the share. Okay, that's not bad. Does anybody have any questions regarding that? If you do, I can turn your microphone on and you can ask directly, or you can type your question. Anybody got any questions while I get the next letter up? Anybody got any questions? I'll just get this next letter prepared. No questions? Okay then. Now, what was very short? The letter is very short. Well, I didn't check the word count. I shall do so now. Let me have a look. Word count. Well, no, it's 215 words. So if that's what you're talking about, that's what was the part you mentioned was very short. Which part? Which part did I mention? Oh, the history. Well, all I mean is mixing information within a paragraph is not a good idea. You know, if you're talking about a visit for a paragraph, then usually it should consist of the patient came, what they said, what you found, what you did. Now that has a logic. Instead of referring back to 2008 and jumping about, you know, and I don't have the case notes before me, so I can't really comment on it in detail. But still, that's the point I was trying to make. Not mixing information within paragraphs. I see this occasionally. People trying to put, you know, different things in, and it doesn't quite work out. You have to show a coherence, you know, a logical progression. Ah, hang on. Who is this? Hello, hello. I've turned your microphone on.
Hello, can you hear me?
Yeah.
Yeah. Hi, Kevin. How are you? Thank you so much for your last session. Now, would you please tell me? Yeah. Would you please tell me that for in this case, I wrote this sentence. It was very short information, and I couldn't separate it to a separate paragraph. I mean that was I had to mix it with the first paragraph. In this case, for example, like this, I mean, for a short sentence, is it right to put it separate, or can we mix it in any part, or that's why?
Well, as again, as I say, you know, every letter is different, but just in terms of logic, in that particular paragraph, so you said initially she presented, and then, oh, and by the way she's had osteoarthritis since 2008, it just doesn't quite fit. That's all I'm saying, you know, because the reader, okay, initially she came, oh, and by the way, 10 years ago she had this. So this is why I say you could have maybe put it, you know, if you really wanted, you could put it at the bottom. For your further information, she's had osteoarthritis. Right. Now, I don't have the case notes to hand, but I thought she had a couple of things in the history.
She had also the others, but you know that the most pertinent part was this part that's related to the topic. That's why I choose only the short one, because this is the most important thing that we should mention. That's why I mixed it over there. I think that you are right. It would better to be in the end of the part, or the end of the paragraph, as an off note or something like this that you mentioned.
Yeah. Well, if you did that, it would be good.
Yeah.
But just in terms of readability, reader, you know, reading, okay, the patient came, oh, and now we're going back to 2008. It doesn't make sense. So however way you do it, I mean, it's just a minor point, but you did ask. So anyway, it's not bad.
Thank you.
It's not bad at all. It's not too bad at all. With those other letters which you sent me, as I think you should be okay. What you need to be aware of course, is that every letter is different purposely. And there's no standard. Again, on purposely so. They don't want people using the same shit, the same template, the same thing, because everybody shares it. It's repetitious, it's memorized, and it doesn't work. So this is why you have to take a look at, you know, every letter individually on its merits. And, you know, what's the best way to tell the story? Because it is. I keep saying this, it's a narrative. You have something that you want the reader to do. I want you to do, etc. What you have to do then, whether you put the main issue first, or the history, or you show the series, sequence of events that leads up to it, but you have to construct a narrative that explains why you want the reader to do whatever it is you're asking them. So, you know, so everything is different. You have to put yourself into the shoes of the reader and see how that works out. Okay, right. I'll turn this off because I've got another letter, and I'll come back in a second. So somebody else sent a letter, Dr. Posey, if I pronounced that right. I don't know. Perhaps I have, perhaps not. Let's take a look at that one now. But I'll go back into the group. Okay. Can you see this new letter. Can you see this? Let me just get the chat box out. Yeah? Can you all see this one? You can see this new letter? Okay. So, changes. Okay. Now, okay, right. Mr. Weir. Okay. Now, first things first, right? Now, it's not necessarily wrong to include this, but, you know, I can count. So we don't really need the age. And real estate, is that pertinent? Does the reader need to really know that Mr. Weir is a real estate agent? Do you think that is pertinent? Can somebody tell me what they think? So you're the surgeon, you know, or the specialist, you receive this. Do you need to know that this person sells houses for a living? Possibly not, unless it's pertinent. Now, for example, if they were a coal miner and they were complaining of chest-related conditions, you know, such as emphysema, then yeah, that would be pretty pertinent, you know. But they sell houses for a living. Do we really need that? Maybe not. Okay. So features are consistent with MS. Now, why would it be greatly? Well, of course it would be greatly valued, but do we really need to say this? I've noticed in quite a few letters, some people are overly grateful, you know. It would be greatly appreciated, highly appreciated, greatly valued. Or I'm sure it would by the patient, but I wouldn't say it, you know. We're not doing you a personal favor. What? So somebody's asking about the commas. Yeah, because it's a non-defining relative clause. So, you know, it should be within a pair of commas. We can take it out and it's not going to change the meaning of a sentence, you know. Mr. Weir, whose features are consistent with. Yeah. So, you could have put this, you know, you could have made this into a single sentence, right? You could say something like, I'm writing to request your further neurological assessment, including an MRI scan of Mr. Weir, whose features are consistent with. You could have made that a single sentence. Okay, greatly valued. Well, it sounds like a bit of an arselick, not to mince words. Highly appreciated, greatly valued. Medical professionals, they're doing their job. They're not doing you a personal favor, so you don't really need to be overly polite. Now, Mr. Weir is an overweight smoker man. What's a smoker man? Is this a smoker man? Okay. Now, instead of just dropping on, somebody else, only introduction could be a single sentence. A single sentence, it's not a paragraph, is it? So that should answer, you basically answered your own question there. The introductory sentence, it can be a single sentence. I am requesting that you do this. And then in your paragraph, you explain why. If it's a single sentence, it's not a paragraph, is it? Okay. Now, instead of dropping in a sentence with no introduction, right? So, you know, because like here you have initially on today's visit in light of the above. So why not do the same thing here? Something like, regarding his social and medical history. Yeah, and it's, you know, instead of just simply dropping in a sentence with no introduction, because you have to have a flow, discourse markers, introductory phrasing. Yeah, so I would put something like regarding his social and medical history. Okay, now a smoker man. We don't really need that. Is an overweight smoker, as opposed to what? A smoker. So using these descriptive adjectives. You know, he is an overweight smoker man. We wouldn't really do that. It's not a natural. We say Mr. Weir is overweight and a smoker. We wouldn't do it like an overweight smoker, like a fat smoker. Maybe he is a fat smoker, but we don't usually phrase it in those terms. So Mr. Weir is overweight and a smoker who also has been, so it's like a list, yeah, who also has been suffering from depression since 2010, for which he's on, etc., etc. Okay, so you just need to rephrase that a little bit. Now, what is this? Why is it passive? Mr. Weir was presented. Who presented him? I thought he presented himself. So don't use passive. That doesn't work. Mr. Weir, because if you're using was, it means someone presented him. And that's obviously not the case. He came himself. So don't use passive there. Presented with the complex of terminal witnesses, life investigations. Investigations, again, you're not a detective. And his investigations, what he conducted, his own investigations, because that's how it reads. So you conducted some tests, or you ordered some tests which revealed, yeah, not his investigations revealed, because he didn't investigate anything. Okay. I ordered some tests and they revealed, etc., etc. Therefore, a further evaluation of the blood, the blood, what do you mean his blood cholesterol level was advised. What you advised who to evaluate it. Now, use of passive, okay, but this is overused and it doesn't make sense. This would work a lot better in active, yeah? Therefore, I decided for further evaluation, or I mean, who is going to further evaluate? I mean, it doesn't make sense, right? So I don't have the case notes here, but it seems that you would be the GP of Mr. Weir, okay? And he's come to see you, and you've provisionally diagnosed him with MS. And you are referring him to a specialist to confirm this, yeah? So you are the one, you are investigating or testing, you are evaluating, you have done this. So why is it passive? We know who's performed the action, you've performed the action. So, and also, some sentences in passive, such as here, it doesn't make sense. So you know, okay, therefore, a further evaluation by whom was advised. So who was advised? So was he advised to get a further evaluation? Or, you know, so I mean, it doesn't make sense. In addition, lifestyle modifications was, well, it should be were, but also were advised. So who, you know, who's advising whom? It's not clear here. In terms of English, use of passive in this particular paragraph, it doesn't work. It's confusing. Well, to me, it's confusing to the reader, essentially, right? If this were active, it would be a lot better. I did this, I'm going to do that, I advised, okay, but that, I have no idea who's evaluating or who's assessing, because it doesn't actually tell me. So on today's visit, now also I would have put a date on, you know, this. When is it? Okay, so on today's visit, I was a date. Mr. Weir reported no improvement of his condition. He developed few minutes. How can you develop a few minutes of blackout? You mean he experienced? And also, why is it simple past? Did it happen in the examination room? You know, so Mr. Weir reported, okay, so he comes to see you and he's saying, oh, I've had no improvement. Okay, but developed, I think experienced is a better verb here. He experienced a few minutes of blackout, but when? Is this when he's in the examination room? Was this the previous night, the previous day? I'm not sure exactly when this is occurring or when it occurred. Okay. Physical examination or a physical examination, or so we need an article or a pronoun in front of physical examination. The examination showed a loss of sensation is in both his hands, or simply in both hands, because obviously they are his hands, they're not yours or anyone else's hands. The diminished left reflex, therefore CT scan, is that countable? Scan is countable, so we need an article. A CT scan of brain, the brain and lumbar spine were ordered. Well, a CT scan, why is it plural? Is it a singular scan? So either CT scans were ordered or a CT scan was ordered. Don't forget your subject verb. Agreement there. Right to be above, provisionally diagnosed, highly appreciated. Why would it be highly appreciated? If you kindly manage her? Urgently as you manage him, urgently as you deem appropriate. Well, if it's urgently, then that's how you deem it. So, and again, why would it be highly appreciated? You know? So there's a few things here that we need to work on. There's some grammar, there's some vocab. There's a few things here. Now, I'm going to, does anybody want to say anything or ask any questions now? I don't know if the author is here. Is she here? Ah, yeah. Have you got any questions, Doc, about my comments? If you do, now's the time to ask them. I'll turn your microphone on if you want. Would you like to ask me some questions? This is your letter. You want to ask any questions? I've turned your microphone on. Is that a no? Well, it's your letter. You know, you should ask. Okay, Ray has got his hand up. Okay, Ray. Let me try and unmute your microphone. Why is it not working? Have you done something to your microphone, Ray? It won't let me unmute it. Why is this? Ah, right. Okay. Is your microphone on? Ray, you turned it off. Hang on. Right. I'm trying to turn your microphone on. Let me unmute it. All right. Okay, Ray.
Can you hear me? Yes.
Yeah.
Okay. Would you please just have some explanation in the cases? And I'm not talking about this kind of case note. There are some other case notes which usually have more pertinent materials, which we are worried about, which we can omit. I mean that which one we have to omit them, or which are included, and we are facing too many of pertinent material. We cannot handle them in. I mean that, for example, for 220 words or less than that one. So would you please just have some explanation? How can we deal with this problem in general?
Okay, well, without having any particular examples to hand, it's kind of it's going to be very general, the explanation which I give.
Yeah.
But okay, to deal with a word count first, that's not important. Okay, it's only a recommendation. There's no penalty, no automatic penalty, I should say, for word count. Obviously, if it's too long, someone sent me a letter which I corrected yesterday, which was 300 words. That's way too long, way too long. But 220, 40, 50, 60, as long as everything is pertinent. The most important thing here is task achievement, or fulfillment, as they call it. That's the most important thing. That's what the examiners consider first. To what extent have you done as you were asked? Okay, so
yeah,
as long as the task is achieved, the actual number of words is irrelevant. I mean, other things. I saw some people today asking about, should we have a comma after DOB? And I thought, what are you talking about? That's minor, not even, insignificant.
sure.
You should be thinking about grammar, vocab. Have you done what you've asked? Have you included the details? Not, do I have to have a comma after the DOB? That's irrelevant, really. I mean, if you look at this one here, so again, it fulfills its task, but as you can see, there's quite a lot of errors in terms of grammar and phrasing. So even though this, it fulfills its task, the number of errors involved would pull it down by quite a bit, because it is an English test, after all, So there's quite a few things here. I mean, I don't want to say that it is bad, but I mean, obviously, and I do hope that you're not taking the exam on a Friday, because you've got quite a lot to work on if that's the case. This is why I keep saying to people, and they don't take any notice, don't leave your writing till the last minute, till the last week. Don't. Because even if I tell you what your grammatical mistakes are, you still have to work on them, practice them, to internalize them, the rules, so you don't make the mistakes again. Simply me saying your article use is poor, subject, verb, blah, blah, blah. So now you know what your weak points are. But just identification is not rectification, is it?
Yes.
It's not rectification. I can tell you this, but you've got to work on it. You've got to work on it. Work on, what your mistakes are. And you have to internalize it so you consciously don't make the mistakes again. But I've had quite a lot of letters this past week, and I'm sure when I check my email I will have more people saying my exams at the weekend. I said, well, you should have sorted this out at least a month ago, because it takes time and practice to make sure you don't make the same mistakes again. Identification is not rectification. That's the first step. Get someone, preferably a native, that can tell you, okay, articles, prepositions, this is this. Then go and read some grammar books, find some videos on YouTube, practice, get your letters checked again, until it's, it's until you've eliminated it, and then, you'll be okay. But in terms of what you're asking, it's difficult, I know, but you have to put yourself again in the shoes of the reader. What would they want? What do they need? And that should guide you as to what you should include. That's basically it. That's all what you can do. There's some things, like say you've got several visits and they're mostly inconsequential or pretty similar, you can group those into a single paragraph. So let's go, Mr. Weir is a regular patient of mine who I have seen on several occasions over the last 10 years for various medical conditions, all of which have been treated. So that could cover like 2, 3, 4, 5 separate visits. You can do something such as that.
Yeah.
You know what I mean? So
yes.
you can group similar information. You don't have to put visit 1, 2, 3, 4, 5, 6. You can maybe draw some of them together if there's a common, like a thread, like such as the, who's that guy who's so tired, he's got diabetes, I don't know, and it's like he's like visited on several occasions, 2, 3, 4, 5, and every time the conditions are the same, he's always tired, exhausted. So I can't remember the name, but it's a common one. It's one of the OET ones. And you would
Prema Sharma,
yeah,
I think.
You do something such as that. You say, Mr. Sharma, I have seen Mr. Sharma on several occasions in the past year, complaining of tiredness and etc., which I have treated accordingly, or something such as that. So you can put several things in a single paragraph. There's no need to put them all.
Yeah. Thank you.
That's okay. Right. So, Dr. Tabosi, I'll turn. I'll turn it on and see if it works. If you want to. Is it working? Unmute. Let me turn your microphone on. Perhaps you want to. No, doesn't seem to. You're right. Your microphone's turned on. Have you got any questions?
Thank you very much for the assessment. I have a question that what tense I should use in initial visit. Is there any particular tense, or I can use past or past participle, past perfect, both?
It depends on what you want to say, obviously. If it's just a simple past, Mr. Weir presented. I mean, in terms of this letter here, right, which you sent me here, so you've got this use of passive here, so that it doesn't work because he's not presented by someone else. He presented himself. So that's the first one here. Then we've got several subject verbs which do not agree. The modifications were instead of modifications was, etc. A couple of articles, a loss of sensation, a CT scan, a brain. As I said, if it's a CT scan, it's singular, or if it's CT scans, then it could be were. So these very basic grammatical mistakes, really, they need to be sorted out because it's pretty basic stuff. It's not like past perfect or conditional sentences. It's pretty basic. Articles and subject verb agreements. This is like pretty basic stuff in terms of grammar. Now, I don't want to, this is not aimed at you personally, but I've had a couple of letters this week, and whoever, I won't say who the author was, but they shouldn't be taking this exam this weekend because their English is not sufficient. There's a couple of people and their English is not up to the particular task. Now, maybe you don't have a choice, you've got to have it this weekend, but I've had a couple of people this past week and their English is not sufficient. And unfortunately, I had a feeling that they would be let down in the test because of it. So.
Okay, but I have exam on 18th May and I'm confused and scared now.
Well, I have just analysed it here. As I say, articles and subject verb agreements. I would, there's lots of videos, lots of lessons on YouTube and the internet, I would go and take a look at those. The main grammar in this is articles and subject-verb agreement. That's what I would take a look at.
Okay, thank you.
Okay, so there's lots of lessons available on YouTube and the internet. I would go and spend a few hours working on those. In terms of that, most of the grammar's okay, but this is pretty basic stuff, you know, so I would go and spend a bit of time on that. Okay, so let's see, what else have we got? I might go back to the group. Oh, hang on. You've got some more questions, Ray? Hello? Are you there, Ray? You got some more questions?
No, I don't have.
Oh, right.
Yeah.
Okay. Your hand was up.
No, it was for previous year.
Okay. Now I'm just going to turn off the share. I'm going to go into the group and see if anybody has posted anything else, and I'll come back and we'll see. I'll just have a quick look, see if anybody's posted any other letters. If they have, I'll copy and paste it, and we can have a quick look. What do we have here? Anybody posted anything? Ah, okay. Yeah. Somebody's put a couple here. Let me see what we've got. Dasha. Okay, I don't think I've looked at hers. Let me just grab this. We just grab this and put it into a document, and we'll have a quick look. Okay, because I've got to go at past. I've got somebody coming who wants to do some speaking practice. So let me just do a share and let's have a look at this one. So, okay. Right, let me just sort this out. If you've got any other questions, you'll have to write to me in Telegram. Nice participants. Right. Okay. So this is Dasha. Okay. This is yours, which I just found in the group. So let's have a look at it and let's see what we've got. So who is this? Sally McConville. This is a one person with asthma. Okay. I'm writing to request urgent. No, right. 38 years old, and you don't need a hyphen. So you can either do aged 38 or 38 years old. Okay. Right, two questions. My patient who has a well-known history of asthma and the features are suggestive of pneumonia. Okay, now that's what I was talking about, and I said you can put it into a single sentence. Okay. The request, I want you to do, etc., etc., and then you're going to tell the reader why or what has led you to make such a request. Now, if you're dropping in sentences with no introduction, okay, so regarding her medical history, that's always good because then it spells out what we are reading and it provides a structure to your letter. Okay. Miss McConville has had tenure, which has been treated with treatment. Okay, that's good. She presented with a unpleasant cough, a feverish. A feverish what? Feverish is an adjective. Feverish is what? A feverish what? So she was a feverish. So you mean she had a fever? Okay, because that is countable. Okay, productive cough, a fever, and wheezing, or productive cough. So you could probably put coughing and wheezing together because it's basically the same, you know, coughing, wheezing. So you could probably put those two together. So a runny nose, productive coughing, wheezing, and a fever. Okay. A redness of her throat, and scattered wheeze were assultated. Okay, I'm sure they were. I don't know why that is passive. Therefore, a viral infection were diagnosed. Well, a viral infection with a mild asthma attack. A secondary what? So that's an adjective. What's that? Why is that at the end? So it should be a noun. A secondary what with secondary a condition of what? So I don't know why that is passive. You examined her, so why is it passive? And what is this? This is an adjective, so we need a noun. So I'm not quite sure what that means. Ventolin was prescribed with two puff. Puff, is it countable? Well, yes, 1 puff, 2 puffs every 4 hours. And the continuation was recommended. Recommended by whom? Presumably you, so why is it not active? Okay, after 2 days she presented again with dyspnea and exacerbation of her symptoms with minimal. Exacerbation of her symptoms with minimal exertion. So how can you present with exacerbation of, so she presented complaining of, or she reported her symptoms were exacerbated, but using this noun phrasing or nominalization, it doesn't quite work. She presented again complaining of a worsening of her symptoms, an exacerbation of her symptoms upon minimal exertion. So that needs a bit of reworking to make sense. On examination, what would increase were observed. Okay. As a consequence, returns were given. Again, why is this all passive? Were you not present? Did you not perform these actions? Okay. On today's review, there was no improvement in her symptoms. In addition, use of her accessory, the use, so she detects. So again, why is it? It's kind of passive. What? Were you not there? Were you not performing some actions? Okay. Use of accessory muscle word detected on the examination. So on examination, I would put that first. In addition, upon examination, I noticed that she was, etc., etc., and I gave her a single dose. I think that's slightly little overuse of passive, I think. I was going to find she has pneumonia, admission for deteriorating condition. Okay, that's a good closing. Okay, that's a good opening. That's not bad. But there's a lot of overuse of passive here. Some of the, use of passive is good, but if you overuse it, it can make sentences long and clumsy. Sometimes active voice is better. It's simpler. I did, the patient came, she complained of this, I examined, I found, and I did this. Isn't that better than saying this was done, were diagnosed, were given? It was you who performed these actions, yeah? So try not to overuse passive. Now, use of passive's good, say like, oh, sorry, that's my alarm. Use of passive's good if, for example, you are a doctor in a clinic or at a hospital and a patient has come to the hospital and we don't know who performed the actions, then use of passive then would be expected. Because it could have been a junior doctor, it could have been a nurse, etc. We don't actually know. But if she came to see you, then you don't really need to overuse passive. Okay, now, have you got any questions? Because I've got 5 minutes and I've got to go. Dasha, so I'm going to turn your microphone on. Have you got any questions?
Oh, yeah. Okay, I have one question. Why overuse passive voice is not recommended? Because when you write any letter, it's very obvious that you detect, you observe, you scold, you do everything.
Yeah, so why not? Well, it's not obvious, is it? if you don't say that you performed the action, I've got no idea who performed it. And one reason why we use it is when we don't know who performed the action. That's one reason why we use passive. There's several reasons, like 4, 5, 6 reasons. One of which is when we do not know who performed the action in question. But here, we do. It was you. So you can use active. And also, as I said, some sentences in passive are very difficult to understand. You know,
Okay.
some like times active voice is simpler. I found this, I did that, she said this, we did that. That's easier, and this was done, and this has been found. So you can use passive, yeah, but try not. It's the same with any structure. Try not to overuse it.
Okay, fine.
Because
Thanks.
you are supposed to be showing a range of structures, because it's an English test. It's an opportunity for you to demonstrate what you can do. And if all you can do is passive, well, that's what the examiner will think. That's all that you can do, because it's constant passive. So you can mix it up a bit, you know?
Okay, fine.
Okay. But apart from that, the grammar's good. Okay. Just watch it, because some of the sentences to a native eye are a little bit unnatural with overuse of passive. Okay? But
Okay.
general terms, the English is good. Just try not to over it. And, that introduction's good, right? That closing's good. Okay? That's like good. It's just this paragraph here. Were ascertained, was prescribed, were diagnosed, were noted, were given. It's like, it's a bit much. Okay?
Okay, thanks.
Okay. So anyway, but apart from that, it's good. Right, I'm going to go. Got somebody coming in a few minutes' time on Skype. So, very good. I'll be back tomorrow. I'm going to save these letters with the changes, and I'll post them in the group. I'll be back sometime tomorrow, not sure when. Depends on my schedule. So if anybody's got any questions, I'll be available on Telegram for a while, then later in the evening. Okay, so time for me to go. I did record this, and I'll save it to the channel in due course. Okay, so turn that off, and I'll see you later.